Welcome back to another Score Builders question and answer video session. This video provides members of the Score Builders team with the opportunity to explore challenging multiple choice examination questions with students actively preparing for the licensing examination. My name is Scott Giles, and I will be your host for today's journey. I will read the question and provide you with an additional 60 seconds to answer the question. Ready? Let's go. A physical therapist prepares to assist a patient with a sliding board transfer from a wheelchair to a bed. Which of the following directions would be most appropriate when directing the patient to perform the transfer? Option 1. Adjust the bed height so it is 4 inches lower than the wheelchair seat. Option 2. Position the wheelchair so that it's at a slight angle to the bed. Option 3. Remove both armrests from the wheelchair before positioning the transfer board. Option 4. Leave the elbows bent as you move the body laterally on the transfer board. A sliding board transfer is used for a patient who has some sitting balance, some upper extremity strength, and can adequately follow directions. The patient should be positioned at the edge of the wheelchair or bed and should lean to one side while placing one end of the sliding board sufficiently under the proximal thigh. Transfer boards, also referred to as sliding boards, come in lengths ranging from 24 to 36 inches and widths of 8 to 12 inches. The question basically requires a student to rule in, yes, or rule out, no, each of the options. Let's take a look. Option 1. Adjust the bed height so it is 4 inches lower than the wheelchair seat. When preparing to perform a sliding board transfer, the patient should adjust the bed height if possible so that it's at the same level as a wheelchair seat. This will allow for the transfer board to be relatively flat while the patient is performing the transfer. Option 2. Position the wheelchair so that it is at a slight angle to the bed. When positioning the wheelchair next to the bed, the side of the wheelchair should be close to the bed and at a slight angle. Angling the wheelchair prevents the drive wheel from putting added distance between the two transfer surfaces. Option 3. Remove both armrests from the wheelchair before positioning the transfer board. When performing a sliding board transfer, it's necessary for the patient to remove the armrest that is nearest to the bed so that the transfer board can be properly positioned. However, it would be unnecessary for the patient to remove both armrests. Option 4. Leave the elbows bent as you move the body laterally on the transfer board. Once the transfer board is positioned, the patient should initiate the transfer movement by depressing the shoulder blades and pushing down with both arms, that is to say, extending the elbows. This movement would clear the buttocks from the seating surface and allow the patient to move laterally on the transfer board. Leaving the elbows bent would inhibit the patient's ability to lift their buttocks from the seating surface. The correct answer is option 2. Let's explore the all-student data. 20% of students selected option 1, adjust the bed height so it is 4 inches lower than the wheelchair seat. 55% of students selected option 2, position the wheelchair so that it's at a slight angle to the bed. The correct response. 10% of students selected option 3, remove both armrests from the wheelchair before positioning the transfer board. 15% of students selected option 4, leave the elbows bent as you move the body laterally on the transfer board. System classification. This question is a non-systems question, which represents approximately 14% of all exam items. Content outline classification. This question is an equipment, devices, and technologies, therapeutic modalities question, which represents approximately 6% of all exam items. Level classification. This question is a level 1 question since the question requires students to possess basic foundational academic knowledge. Remediation of level 1 questions occurs through academic review of entry-level content using textbooks, review books, Basecamp, and flashcards. Academic focus area. Looking to review related academic content? Check out pages 692 through 694 in PT Exam the Complete Study Guide. Thanks for joining us on the Score Builder's question and answer video session. See you next week.